Hello dear students, how do you do? Must be enjoying your studies. The word enjoying I used because students have nothing to do more than the studies. Yes, you have to involve yourself in social also, society, social media, etc. But studies are the priority for a student, and at least for medical students, studies is the number one priority for proper career and for future success in life. So, myself, Dr. Ashok Kumar Rana, MD Medicine. Today's topic, a very common topic for dental students, is diabetes and oral health. Diabetes mellitus and oral health. Now, as you know, that uncontrolled diabetes leads to a lot of complications involving from the eyes retinopathy, heart, coronary artery disease, then in the kidneys nephropathy, in the peripheral nerves neuropathy, and in the blood vessels involvement of the periphery leading to gangrene, diabetic foot, and in bones and joints involvement leads to bones and joints involvement for arthrosis, Charcot joints, etc. Now these complications we very well know, and you are supposed to know because you are going to give the examination for BDS medicine subject. Now, away from this, another group of conditions which occur because of hyperglycemia, which remains uncontrolled either because of the patient's non-compliance of drugs or because of the disease process which he is not knowing it. So, what it can lead to? Prolonged hyperglycemia, sustained hyperglycemia can involve mouth by impaired neutrophil function. What is the function neutrophil? To increase the immunity and to call off an infection if it enters the body. Here the neutrophil function gets deranged because of hyperglycemia. Second is microangiopathy. Microangiopathy means small blood vessels, they are affected by atherosclerosis leading to poor blood flow to the parts supplied by the vessel. That is called microangiopathy. Then neuropathy. The nerves which supply the oral cavity, bones, here, the teeth, the gingiva, they are also affected by the nerve, by the diabetes, leading to their compromised function, that is neuropathy. And similarly, fourth point is collagen synthesis is deranged, which helps in proper regeneration of the ulcers. So these are important causes of oral ill health in patient of diabetes. Now, what are the various oral manifestations in patients of diabetes? They are indirectly caused by diabetes or hyperglycemia. Number one is xerostomia. Xerostomia means dryness of mouth. Xerostomia, dryness of mouth. Number two, dental caries. Dental caries. Number 3 is the gingivitis. Number 3 is the gingivitis. Number 4, periodontal diseases. Periodontal diseases. Number 5 is the oral thrush. Number 6 is the burning mouth syndrome और burning mouth feeling. पेशेंट कहेगा कि मेरे मुंह में जलन सी होती रहती है सर. Burning mouth. Then number 7, altered taste. पेशेंट कहता है कि मेरे मुंह का स्वाद जो है, टेस्ट है, बदल गया है. मेरे को मीठा नहीं पता लगता, मेरे को नमकीन नहीं पता लगता, मेरे को कड़वा कड़वा लगता रहता है. देन जोग्राफिकल टंग. Geographical tongue, coated tongue, then oral lichen planus. It is a pre-malignant disease. Oral lichen planus. Eleven number is recurrent aphthous stomatitis. मुंह में छाले होना. पेशेंट कहता है कि मेरे मुंह में बारी बारी छाले हो रहे हैं. Recurrent aphthous stomatitis. And then poor wound healing. Poor wound healing. Now these are important oral manifestations associated with diabetes. Now coming to the first xerostomia. So that is dryness of mouth. What happens? There is altered salivary function. Salivary glands, parotid, sublingual, submandibular are there. So the function is altered, leading to reduced saliva flow. Saliva composition is altered, and so it leads to patient को क्या दिक्कत होती है ड्राइनेस में? ट्रबल इन स्पीकिंग. मुंह सूख जाता है बोलते बोलते. ट्रबल इन च्यूइंग. च्यू करने के लिए हमें सलाइवा चाहिए. दैट इज ऑल्सो डिफिकल्ट. देन स्वेलोइंग ऑल्सो. स्वेलो करने के लिए भी हमें मुंह में सलाइवा चाहिए. तो ये स्पीकिंग, स्वेलोइंग, च्यूइंग एंड ईटिंग. So all these functions are disturbed by the condition that is xerostomia, dryness of mouth. Then second is dental caries. Now in dental caries there occurs necrosis of the pulp of the tooth and apical periodontal necrosis, leading to involvement of the tooth and patient get this dental caries. It has higher incidence in patients of diabetes. Then number third, periodontal disease. In periodontal disease there occurs periodontitis, alveolar bone loss. alveoli के नीचे बोन जो है उसका लॉस हो जाता है और पेरियोडोंटाइटिस होता है. और इट इज़ बिकॉज ऑफ associated other factors, poor orodental hygiene, then smoking, tobacco chewing, improper brushing of teeth, etc. So this may lead to periodontal disease. Then various oral infections like bacterial, fungal infections may be more common in patients of diabetes, like oral thrush is very common. Then another important condition out of all these, burning mouth. This is also known as glossodynia. In this oral dysesthesia, that is patient says कि मेरे मुंह में हर टाइम ना आग सी लगी रहती है. So it is because of poor diabetes control. The patient can say burning sensation, tingling sensation, electric shock like sensation, or stabbing sensation in the mouth or oral cavity. So this will be burning mouth. Then taste dysfunction. Here it is taste dysfunction. Burning and then taste. In this taste dysfunction, patient will say that my taste is impaired. Salt taste abnormality, sweet taste abnormality, and it is because of the salivary gland dysfunction and neuropathy. So these two things are affected by uncontrolled diabetes and so leads to neuropathy and salivary gland malfunction. Now I hope you must be enjoying the topic. This is very common topic. So go to Google Play Store, download the app Dr. Ashok Kumar Rana and subscribe to it, and look for the other videos and free material which is lying there on the app. Coming back to the topic, then oral mucosa changes. They may be coated and fissured tongue. आपने देखा होगा जीभ कटी कटी दिखती है पेशेंट की, सफ़ेद टंग दिखती है, geographical टंग दिखती है. Geographical tongue, coated tongue, I will make the diagram to make it clear. Now suppose this is the tongue. Now what happens in geographical tongue? In geographical tongue, this is a normal. This appears to be map of some country. That is why it is called geographical tongue. In cracked or fissured tongue, there are like cracks here. Cracks on the surface of the tongue. So coated and fissured tongue, character, then geographical tongue, then recurrent aphthous stomatitis. मुंह के अंदर जो छाले हो जाते हैं वो recurrent होते हैं because of the poor orodental hygiene, poor diabetes control. So these may occur. Then very important finding is oral lichen planus, OLP. This is pre-malignant. It may lead to malignancy later on. So whenever you diagnose a case of oral LP, lichen planus, get a biopsy and then find out whether any element of malignancy is there in the tissue or not. So it is common in patients of type 1 diabetes as compared to type 2 diabetes, oral lichen planus. Then another important is poor oral wound healing. जैसे कोई मुंह में चोट लग गई, कोई भी चीज़ खाते हुए लग गई, फिश खाते हैं, जैसे नॉन वेज है, उसका कांटा लग गया, चिकन खाते हो उसकी बोन से इंजरी हो गई, तो उसमें क्या है, पुअर ओरल हीलिंग होगी उसमें, पेशेंट में हीलिंग नहीं होती प्रॉपर बिकॉज ऑफ न्यूट्रोफिल डिसफंक्शन एंड माइक्रो एंजियोपैथी। ब्लड सप्लाई नहीं प्रॉपर आ रही, न्यूट्रोफिल प्रॉपर बैक्टीरिया को किल नहीं कर रहे, सो दैट विल लीड टू पुअर वोंड हीलिंग एंड स्लो हीलिंग ऑफ द soft and hard tissues. So keeping in view these manifestations of oral health in patients of uncontrolled diabetes, we recommend to these fellows, number 1, good oral dental hygiene. Good oral dental hygiene, that means proper brushing of teeth, proper maintenance of oral hygiene. Number 2, routine oral checkup by a dentist. जो डेंटिस्ट को भी 6 महीने में एक बार जरूर चेक करवाना चाहिए. Number 3, proper control of diabetes, so that these oral manifestations, if occur, cure early and ultimately they should be avoided. Another important recommendation is that dentists should be the part of interdisciplinary medical team for the treatment of a diabetic. जैसे कि डायबिटीज़ के पेशेंट में सर्जन की इन्वॉल्वमेंट होती है, डायबिटिक फुट फिजिशियन, देन physiotherapist. Similarly, dentist should be also a part of the team for treatment of oral health in a diabetic patient. So with this small topic but very important day-to-day burning topic is discussed by me, and you are requested to go in for, अगर आपको अच्छा लगा तो मेरे उस पर गूगल प्ले स्टोर पर जाइए, उसको क्या करेंगे, डाउनलोड करें, मेरी ऐप को डाउनलोड करें, क्लास प्लस ऐप जो है डॉक्टर अशोक कुमार राणा, उसको डाउनलोड करें. उसका मैंने ऐप का अपना लिंक इसमें दे रखा है वीडियो में, उस लिंक से आप जाके डाउनलोड करें और सब्सक्राइब करें. एंड देन इफ़ यू फील लाइक यू परचेज इट, आप 5 स्टूडेंट्स का ग्रुप, 10 स्टूडेंट्स का ग्रुप बना सकते हैं, तो आपको हम डिस्काउंट देंगे अपने प्राइस उस पर. सो दैट्स ऑल फॉर टुडे. थैंक यू.